Hey everybody, welcome to a special episode of Pick Dr. Osborne's Brain. Special because we get to pick a triple board certified OB-GYN's brain, Dr. Anna Cabeca, your girlfriend doctor, and I'm excited to have her here today because we're going to be talking about some of the things that oftentimes women are just scared to talk about. They don't have the confidence or the external courage to bring some of these tough questions to light about health. Dr. Anna, thanks so much for being with us today.
It's a thrill to be here. Thanks for having me. Great to be here with all of you.
So dive into, we were talking earlier and you were talking about some of the challenges that women have with even engaging in a conversation. Like, walk us through that. What are some of those biggest challenges that you've seen in your experience in practice?
Yeah, I think one of the most important things is for women to know that you're not alone. When you're struggling with feeling symptoms of like, hey, I just don't want to have sex, like that sexless marriage issue, that's heartbreaking. And you know that you don't want to live your life this way. When you're struggling with symptoms of incontinence, leaking, when you cough or sneeze, you know you don't want to live this way, but what are the alternatives? And not being able to have a conversation. I always tell women, I said, you can ask me anything you would ask your best girlfriend if she was a triple board certified OB-GYN. Like, what's on your heart? What answers do you need? Because often we don't know where to go. We're afraid that there's not an answer. We're abnormal. Like or there's that sense that I'm alone in this. And that fear is something we have to overcome. And we have to start talking about this in an open, authentic way, having these conversations with our best girlfriends, because you're not alone. And as you start having the conversation, you will see that you're absolutely not alone in these issues, from vaginal dryness, leaking when we cough or sneeze, having issues with discomfort or desire or disconnect, right? Those are the 3 Ds that I talk about often. Discomfort when we have sex or after sex, having discharge and odors, the loss of desire, like I never want to initiate sex, help me, like what's wrong with me? There's something wrong with me because I have a great relationship, great partner. And the disconnect, feeling like I'm just alone, I'm disconnected, I'm feeling that burnout. And that can be, I know I love my partner, I just don't feel love for them, and how that can affect us in relationship. And that's really a scary place to be. That's really a scary place to be. And there are solutions for all of these. There are solutions for every single one of the issues that we experience in a very holistic and natural way. And it's often not mainstream. It's often not mainstream. Even when we speak to our physician about it, we may not have an answer other than surgery, or, hey, maybe you just, you've been married this many years, or this is normal, right? But in your heart that it's not optimal, and it's not how you want to continue to live. And this is where it's really important. And this is where I struggled personally as a boarded OB-GYN. I had my own personal journey, delivered 4 large babies vaginally. Thank you very much. And I had issues with desire, with pelvic pain, with incontinence issues, and there wasn't any acceptable treatment for me. Did I want to have surgeries that I performed? Not necessarily, not if I could avoid it, right? And that's what took me on my own personal healing journey, and to find and create solutions that make a difference for women.
Let's talk about some of the solutions. Top couple of things that you did that you felt like made the biggest impact, moving you in the right direction with those symptoms.
Yeah, the first thing was really digging into sexual health and sexual medicine, and understanding where bioidentical hormones can have a role, especially when it comes to vaginal health, right? There are a few things that improve vaginal health naturally that we all have access to. And so there's, like, for instance, doing pelvic floor exercises. I'm here with the gluten-free expert, so I got to say this: getting rid of grains, getting gluten-free, because inflammation in our intestines, the vagina is an extension of that. Okay. So really cleaning up our diet, that's critically important, with healthy fats and probiotics. And so a healthy vagina makes a whole difference. And yes, as we age, things change, but that's where we can use some bioidentical hormones to help with vaginal health. And that and as I started using that in my own medical practice, my patients would come in and say, I don't need that surgery. I'm not having those symptoms anymore. Or, I'm feeling so much better. And I'll never forget, a patient yelled at me down the hall. I had a full office. She saw me and she'd come into the office. She goes, Dr. Anna, you made my vagina 21 again. Thank you. And I was like, oh my gosh, it was very funny.
So I know a lot of women listening.
You guys don't
today,
talk about this very much, do you?
Maybe they want a 21-year-old vagina again, and maybe they just want to feel like a little bit better. So you mentioned bioidentical hormones, and in all seriousness, what are we talking about? Are we talking about estrogen, progesterone, DHEA? Like, because there's so much estrogen dominance, on the front of women's hormone problems now. What would you say? What kind of combination do you typically see? I know you can't answer everybody's exact.
Right. Yeah. So I think that definitely as we're getting older and struggling with vaginal dryness, often what we're prescribed is vaginal estrogen. And vaginal estrogen only works on the mucosal layer. It doesn't work deeper to the deeper tissues. When we get into androgens or DHEA, those are things that we can do that can really help. So physicians can prescribe that for vaginal use, and that can make a big difference. One of the things that I've done is using, in customizing hormones in my practice, was using a lot of vaginal options. And then when I retired my practice, my patients were like, no one will give me that prescription. And so that's where I work to really create a cosmetic cream that we can use on our pelvic floor. I will say most important real estate of our body, that pelvic floor, so important. Like, do not neglect it as we get older, because we'll get into trouble. So that I created a product with DHEA in it, plus some plant stem cells using stem cell technology. Actually, I use the Alpine Rose plant stem cells. And this is, Peter, like, it's one of my favorite plants. It's this rose that blossoms in the Swiss Alps amongst the harsh conditions of ice, snow, and rocky terrain. If that doesn't depict femininity, I don't know what does, right?
Absolutely.
We are blossoming in the midst of some messy areas. But the Alpine Rose plant stem cells are really, really beneficial and have shown some amazing properties in and of itself. The research around it has shown certainly the improvement in fine lines and wrinkles and collagen, as well as antiviral properties, which is pretty powerful. And the combination with DHEA and the other ingredients that I put in my product Julva, it's been really very natural way, no parabens, no phthalates, no chemicals, a very nice, clean way, because the pelvic floor is very vascular. So using many of the feminine hygiene products or lubricants that are out there, we're like sucking up some toxins that we don't want to be into our body. And so it's important to, again, eliminate toxins that our body doesn't need and just nourish our body with ingredients that we do.
So would you suggest then, somebody listening to this is like, okay, I'm interested in DHEA. I'm going to go talk to my doctor. Do they measure the DHEA to find out whether or not the woman maybe is low in DHEA? Like, how does that process go if they're going to their doctor? Or is it very safe to just take it vaginally and it's not necessarily something that you have to go to the doctor for? Like, help us understand that.
Yeah. With DHEA, it's been over the counter in the US for decades, right? And we have a lot of safety profiles with it. And we know that it peaks for most all of us in our 20s and starts to decline thereafter. So DHEA in general has a great safety profile, especially for those of us over 40. There's a lot of benefits with DHEA. And because DHEA is in a cream and a transdermal application that we're just applying topically, there's minimal absorption systemically. So it won't really necessarily affect you, but we want to increase our DHEA. And that's where I use my Mighty Maca product. My Mighty Maca Plus, the superfood combination. What we've seen is as much as a 70% increase in DHEA in as little as 2 months when you're taking just 2 scoops a day of Mighty Maca. So because you're supporting the adrenals, it's adaptogen to support the adrenals, detox from chemicals, as well as support alkalinization, which is very, very helpful. So a clean way to energize and also help with hormone balance and support your body's natural inflammatory response. So the combination of the two, I would say that the triad is you use your, eliminate let's say it's more four key things. Eliminate those toxins that are disrupting your body, right? and do pelvic floor exercises. And then as we age, we want to supplement with nourishing ingredients that help support our libido, our hormonal balance, and our body's natural response, natural inflammatory response. So the mighty maca, and then natural ingredients like Julva to apply directly. We worry about our eyes. We're putting cream on our eyes and face and all this, but we're wrinkling and losing muscle strength in our pelvic floor area. That sets us up for discomfort, discomfort with sex, lack of enjoyment, lack of pleasure, decrease in desire, and that's not something we want to live with for the rest of our lives, nor do we have to. So addressing with those 4 key things makes a really big difference in women's lives.
So the pelvic floor, you mentioned that the exercises, I love that, because muscle atrophy occurs as we age, right? Yes. Sarcopenia, the term a lot of doctors throw around as age-related muscle loss. Most people think to do arm curls or shoulder presses or push-ups or that type of thing, but pelvic floor, just kind of ignore the muscles of the pelvic floor. Is there a certain time or quantity of exercise that you would focus on?
Yeah, definitely. And 2, to avoid exercises that increase a lot of abdominal pressure on the pelvic floor, and knowing when to inhale and exhale so you're not putting more pressure on the pelvic floor is really important. So pelvic floor exercises or Kegel exercises that we've named for strengthening the pelvic floor are important. I always told my pregnant patients, you're going to do these until you die, right? Just know that just like you would go to the gym and work different muscle groups, you want to work your pelvic floor muscle groups. And so 3 to 5 times a week, do 3 to 4 sets of pelvic floor exercises. So you can just think, okay, maybe you do, a few days a week, you're every stop sign if you're driving, or commercial break if you're watching TV, just to remember to do these pelvic floor exercises. And I have a great little YouTube video. It's the right way to do pelvic floor exercises, because if you think of your pelvic floor as this, if you look at it this way as this sling, you want to contract your muscles up and in and together at the same time. And you want to do it on an exhale. And that contraction, so you can try that together, just pelvic floor, exhale, and contract your pelvic floor muscles. So you're squeezing everything together and up. And for example, if you were having to you have to urinate, try to stop the flow of urine by contracting the pelvic floor muscles and pulling up. As women get older, we've forgotten about this, or we've had babies, we may have some fascial tears, some relaxation in the pelvic floor. And so strengthening the muscles is really important. And as we strengthen the muscles, that improves blood flow, that improves your glandular secretion. So it's always part of the prescription. And I would say 8 sets. When you contract, try to hold it for 8 to 10 seconds. You may start at only 1 to 2 seconds. That's okay. But keep doing it and make a cue so that no one knows you're doing your pelvic floor exercises. You're on the phone call, you're on a Zoom call, you're watching Dr. Osborne.
I'm doing them right now.
Doing them right now, right. And it's just really important to do them, not to forget. So make a mental note to really focus on doing them. And if you go to the gym and you do the treadmill, you can do them while you're on the treadmill, but take that time to actually do focused pelvic floor exercises. And when you're doing it, visualize your muscles coming together and up. And that just really does help with that. And there are a couple, pelvic floor exercisers, and that can be used vaginally to help give some biofeedback. There are some that are created right now. I think one is the PeriFit, and then there are Kegel balls, and things like that can also help with, focused training of the pelvic floor muscles. But I can't emphasize enough how important that is.
Fantastic. So detox, grain-free diet,
yes,
right? Keto style.
Yeah, Keto Green style. We say Keto Green in my neck of the woods.
Keto Green. And then Keto Green 16, if you want to pick up a copy of Dr. Anna's latest book. And then as well, beyond those things, pelvic floor exercises. And then you also mentioned maca as an adrenal support adaptogen to help with DHEA production, and then potentially even topical DHEA, very safe, good safety profile, doesn't go systemic, but can increase vascularization in the female area. So those 4 tips, great takeaways. Thank you for being here. Where can people find more about Dr. Anna, the Girlfriend Doctor?
Thank you. So my website, thegirlfrienddoctor.com, on Instagram at thegirlfrienddoctor, and on my Facebook. And we have a great, thriving Keto Green community in our Facebook group, which it's been where we share recipes, and that's been a great resource for people too. So at thegirlfrienddoctor.com.
Awesome. And I'm going to put a couple of links down below this video for you if you would like to check out Dr. Anna's Julva product of DHEA topical application, or if you'd like to check out her Mighty Maca powder, those will be just below this video for you to check out at a discount. So thanks so much for tuning in to Pick Dr. Osborne's Brain. And thank you so much, Dr. Anna, for allowing me to pick your brain. I'm also if you've got questions for Dr. Anna, I'm going to tag her in this so that as your questions come in, even beyond this live video, that maybe she or her team, one of her team members can get back with you and get you an answer. Take care, and we will see you next Monday night, 6 p.m. Central Standard Time for Pick Dr. Osborne's Brain. Take care.